Hey, good morning, everyone, and welcome to UroNurse. We're coming to you live. Yes, live on all those different places. 9 a.m. Central Time every Saturday morning on this beautiful snowy one out by me. Hope it's nice by you guys. But welcome to the show. My name is Vic Sinise, and I'm the host of the show. Gonna get you some information here. If this is your first time checking us out, be sure to go to our UroNurse website at uronurse.com to learn more about the show. Also, we can have quick links to our sponsors who help sponsor this show. You can get to their websites right from our website. And we have a bunch of podcasts now out. Dr. Jeff Sex Talk, Europatient.com, boot camp for learning how to stream. All those things are available, and they've got quick links from our website. So it's the main place you want to go. Plus, if you want to check out any of our past episodes, that's the place to visit too. We have all of our episodes available with quick links over to the episodes. Now, a lot of you have really been burning up the roadways listening to UroNurse in your car. That's great. So good that I've actually created a web page now devoted strictly to the audio podcast. It's on our UroNurse website. Just go there. You'll see a thing that says audio. Click on it. It'll bring you over to this site where you can pick your favorite podcasting platform. And we just added iHeart Podcast to the list of things to listen to. So no problem listening to us in your car. This week, we're going to have a contact hour, 0.75 contact hour with Dr. Laurel Robinson joining us to talk about PPEs. I thought it'd be a good idea to talk a little bit about the personal protective equipment that we use every day. And we'll have a little discussion after the show. But right now, let's go ahead and bring in our experts. Experts, welcome to the show. Hey, Lori, how you doing?
Good morning.
Hi. How's everything? How's everything by you?
Oh, it's the snow is. I'm ready for it to end. The winter. I need the spring to start. Good morning, everyone. My name is Lori Atkinson. I'm a certified urology registered nurse. I have been in urology since 1998, and I currently work for Northwestern Medicine in Geneva and Winfield, Illinois.
Great. And welcome to the show. Lori will be watching over our comment area to make sure that you guys, if you have any good comments, we get those brought in during the show. This show in particular is going to have just the about 37-minute from Dr. Laurel, who's going to be talking about PPEs. But then we're going to come back on live afterwards and discuss. So have your questions ready. We want to talk about what are you doing for PPEs? Are there any issues you're having, any problems? So let's go ahead and bring in Dr. Laurel Robinson.
Hello, my name is Dr. Laurel Robinson, and I am here to talk to you about personal protective equipment, or PPE, and the role it plays in infection control. This content has been reviewed and approved by the Centers for Disease Control and Prevention, Project First Line. Project First Line is a national collaborative led by the U.S. Centers for Disease Control and Prevention to provide infection control training and education to frontline healthcare workers and public health personnel. The Kentucky Infection Prevention Training Center is proud to partner with the Kentucky Department of Public Health and Project First Line. Funding for the Kentucky Infection Prevention Training Center is provided through the Centers for Disease Control and Prevention, Epidemiology and Laboratory Capacity, Enhancing Detection Grant Supplement Award to the Kentucky Department for Public Health. CDC is an agency within the Department of Health and Human Services. The contents of the simulation skill packets do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. Okay, so the objectives are listed before you. By the end of this skill station and my presentation, we'll be able to better identify patient care situations where eye protection is appropriate. Also, we're going to talk about selecting gown types appropriate for a variety of fluid exposure situations, because yes, there are different types of gowns with different levels of protection. We're also going to identify the correct order of putting on and removing, which is known as donning and doffing, gowns, gloves, eye protection, and respiratory protection. And last but not least, we'll discuss when to perform hand hygiene during these various activities in relation to infection control. So, before we dive in, I would like to turn your attention to the video before you about personal protective equipment. Dr. Abby Carlson of the CDC is going to give a brief but informative overview of PPE and the role it plays in infection control in healthcare.
Hi everyone, welcome back to Inside Infection Control, our video blog here at CDC's Project First Line. I'm Abby Carlson. It's wonderful to have you back. Today we are going to talk about a straightforward but very important question. What is PPE? We use it, we talk about it all the time, we worry about it, we worry whether we have enough and what kinds we should use. But what do we mean by PPE? What is this? PPE is the abbreviation for personal protective equipment. It's the gear that you use to protect yourself and keep yourself from getting exposed to something that can make you sick while you're at work. Many jobs actually have PPE. It's not just in healthcare that we have this. One great example is a firefighter. They use equipment to protect them from the hazards at their job. A helmet to protect them from things falling down on their head. They might use gloves, boots, and a uniform or a pants and coat to protect them from heat. They might protect themselves from smoke with a mask. All of that is personal protective equipment, or PPE. In healthcare PPE, we use PPE to protect us from things in the environment, and our most common problem? Germs. So the unique thing about PPE in healthcare is that it actually serves two purposes, and both of those purposes are really important. One part is to protect you, but the other part is to protect your patients and coworkers from germs that you might be carrying. So for example, when you use a mask, you're not just protecting your nose and mouth from things that you might breathe in or germs that might be, in the air that could make you sick. You're also keeping out germs that you could be breathing out from reaching other people or reaching the environment. Another great example is when you use a gown and gloves. You're not just keeping germs off of your hands and your clothes and keeping yourself clean. You're also keeping any germs that you've gotten on your clothes, on your hands, from spreading to other people, other surfaces, and spreading around healthcare as you do your work. You can see from all of that why it's so important to use your PPE and use it right. But even though it's really important, we have to remember it's not magic. It's not the only thing you do. In fact, it's one of many tools that we use to protect you in your daily work to avoid being exposed to germs. So we use other things like barriers, telemedicine, improving ventilation, good cleaning, and good disinfection practices. But when those things aren't going to be enough and you have to interact with your patient to provide good care and there's risk of spreading germs, you want PPE to reduce that risk both for you and your patient so that it doesn't spread between the two of you. Also remember, we like to say PPE doesn't have a brain. It doesn't have a mind of its own. It relies on you, your brain, your mind, to think about how to use it and use it correctly. So think through using your gear, what you're using, how you're using it. Is it the right time? And you have to go through that process every time to just be sure that you're protected, you're protecting your patient as you're about to go do your work. We'll talk more in future episodes about the different pieces of PPE, how and why they work to keep you safe, and what you need to know to take care of your patients as best as you can.
Thank you, Dr. Carlson. For the purpose of our module today, we will focus on eye protection, gloves, and gowns. Respirators are discussed in depth within their own section of Project First Line. I urge you to explore the Project First Line portion of the CDC website for more information on respirators and other methods of infection control. We just heard Dr. Carlson define PPE and its importance in infection control. Unlike other professions, such as firefighters wearing their uniform and protective gear, in healthcare, PPE is used to not only protect ourselves, but to also protect others around us. So it really is a two-way street here in healthcare. We really have to remember that without other infection control practices, PPE may not even protect us and may even give us a false sense of security. This is why getting back to the basics of why we use PPE is so vital. Having basic knowledge of why you are protecting yourself and others, but also how to select the right PPE to wear for the situation at hand is also part of that process. It is also worth repeating that everyone plays a role in infection prevention, from environmental services and dietary to caregivers, all the way up to administrative offices where you work in close proximity with others. All right, so let's talk a little bit about eye protection. So, with all the focus on masks and gloves, especially during the most recent pandemic, eye protection kind of got left by the wayside. However, if you look at the anatomy of the eye, it offers a portal into the body that germs and pathogens can travel through and cause infection. Viruses and pathogens can also directly infect the eye, such as the all too familiar pink eye that we have all probably encountered at least at one point in our lives. Eye protection is not complicated. You can wear lab glasses, goggles, or even a face shield. Remember, normal eyeglasses do not offer protection on the sides, so they are not considered a form of eye protection. Whatever you use to protect your eyes, please make sure you can see clearly and do your work safely. So let's look at a video about eye protection in the setting of COVID-19 with Dr. Abby Carlson. She will explain the pathway that eyes offer for germs and viruses to enter our bodies.
Hi everyone, and welcome back to Inside Infection Control, our video series here at CDC's Project First Line. I'm Abby Carlson. It's great to have you here today. Today we are going to talk about COVID-19 and the eyes. You've probably seen that eye protection, either goggles or a face shield, is part of the PPE recommended for COVID-19. But why is that? What do the eyes have to do with anything about this? We focus most of the time on protecting our nose and mouth because we think about the virus getting into those target zones of the nose, the mouth, the back of the throat, and the lungs, and then infecting us. But eye protection is needed because the eyes are another way that COVID-19 can get into those places and make you sick. With eye protection, the first thing you might consider is, we're thinking about splashes and sprays of blood or body fluids that might land in the eye. And that's true. That's definitely a consideration. But for COVID-19, we also want to protect our eyes from respiratory droplets because we know those droplets can carry virus and they can get into our bodies through our eyes and infect us. So again, they can reach those target zones in the nose, mouth, and back of the throat through the eyes. How does that happen? What's the connection? Okay, so imagine somebody's coughing at you or even talking at you and some of these little droplets are coming out and they're aimed towards the eye. Well, where do they go? Your eye in its anatomy has a thin, delicate tissue called the conjunctiva, and it covers the inside of your eyelids and part of the eyeball itself. And that is a mucous membrane, so it's like you have inside of your nose and your mouth and other areas of your body. And its job is to keep the eyes nice and protected, and it needs to be hydrated to do that. And so it protects both the membrane and the eye itself. That conjunctiva is covered by a liquid, okay? That liquid are essentially your tears, and that protects your eye and keeps them healthy, making sure they're working correctly. But your tears aren't just salty water. They're actually part of your body's natural defenses, your immune system. They contain chemicals and antibodies that help protect your eye from things that get into your eye, like germs like bacteria, funguses, even viruses. Your tears do a really great job of protecting your eye most of the time, but some things like COVID-19 can get into the eye and cause problems, and that's why we need an extra layer of protection with a goggle or a face shield. Okay, so that liquid, all this liquid is being produced to keep your eye nice and hydrated, nice and wet, but where does it go? Because it's being made every single day. Well, it travels through your tear ducts. So your tear ducts sit right here at the corners of your eyes by the bridge of your nose, and you can see them if you look in the mirror. You'll see a little pinpoint dot where they open up, and they connect your eyes to the nose and the back of your throat. There's actually a little drain that travels in there. And all that liquid that your eyes are making goes down that drain and gets drained out through the back of the throat. This happens every single day and is a normal process. And you can think about it, when you think about yourself crying, right? You know that your nose runs. Well, some of that is because some of that water that you're producing when you get tears is traveling down those tear ducts, down that drain into your nose, and you have your nose comes out the front, it runs, that's your tears draining out. All right, so the things that land in your eyes, like these respiratory droplets we talked about with virus in them, they can hit this eye system, they mix with the liquid in the eyes, they travel down those drains and into the nose and the back of the throat. When the virus gets those places, the nose, the throat, the mouth, it can find cells that it can hack into and cause infection, and that will make you sick. Now, not only that, but it can also infect the eye directly. So we're learning more and more about this, but we found that there are cells within the eye that the virus can also hijack, can get into, and cause infection. They're certainly not the only virus that can do this. One that's really familiar to everybody is pink eye, where you get a nice red, inflamed eye, it's itchy, it hurts. That's caused by a virus, and it's the same thing. It hijacks into a cell and causes infection. COVID-19 doesn't cause those same symptoms. It doesn't make you feel the same way, but it still can get in those cells. It still can make you sick. So we worry about that too. All right, so it makes sense with all of that that we would want to protect our eyes on top of protecting our nose, our mouth, and our throat when we think about it this way, when we think about respiratory droplets. At the same time, while we're protecting our eyes, just a quick note, you want to make sure that you can still see correctly. So however you choose to protect your eyes, make sure that you're still able to do your work and see what's going on.
Now that we better understand how important it is to protect the eyes, I'd also like to show you a quick clip that will display a real-life example of why we should use eye protection as well as other appropriate PPE. Using a powder that glows in UV light, this will demonstrate respiratory droplets which could be carrying pathogens or germs. Let's take a moment to reflect on this simulation. Did you notice anything wrong with the position of the healthcare worker in relation to the patient? Thank goodness this healthcare worker had on eye protection as well as additional PPE to add additional protection. However, standing to the patient's side would be ideal in this situation to avoid unnecessary viral exposure. What could have happened to this healthcare worker in the absence of eye protection? Have you ever witnessed a situation where a spray or splash occurred and eye protection was not worn? So, in review, some key takeaway points here are: germs can enter your body through the eyes and the tear ducts. Germs can also infect the eyes directly, causing irritation and inflammation. Respiratory droplets that can carry germs and viruses can land on your eyes and travel from your eyes to reach the target zones of the nose, mouth, back of the throat, and lungs. If at all possible, avoid standing directly in front of the spray or splash hazard source to decrease potential exposure. Always wear eye protection when there is a risk of cough, splash, or spray. And most importantly, eye protection is not enough worn alone. Use this barrier of protection along with other infection control practices, such as cleaning your hands and additional PPE. So, what about gowns? Gowns are worn to add a barrier of protection to cover your clothing. Even when one is wearing scrubs, gowns will add protection from germs transmitting onto their clothing and potentially contaminating the wearer or others. If you've ever experienced leakage through a gown you were wearing, you know that not all gowns are created equal. There are different levels of gowns for different types of tasks. The Advancement of Medicine Instrumentation, AAMI, provides standards for gowns by testing them for durability against spray impact, liquid penetration, and resistance to bloodborne pathogens. The gowns are rated from level 1 to level 4. Then there is also the unrated gown, which requires you to inspect and determine whether it is appropriate for the task you are wearing it for. So let's review the levels of gowns. Level 1, minimal risk. This would be for a patient in standard isolation, a cover gown for visitors, or someone performing just basic patient care. Level 2, low risk. You would wear this gown when performing blood draws, suturing, perhaps working in the ICU, or a pathology lab. Level 3, moderate risk. Use this gown when performing an arterial blood draw or inserting an IV, perhaps working in the emergency department or on a trauma case. And level 4, high risk. This is a gown you would want to wear during long, fluid, intense procedures, perhaps surgeries, or when infectious diseases are suspected, non-airborne. No matter what type of gown you are wearing, you want to try to follow some of these practices. Wear a gown for direct patient care if the patient has uncontrolled secretions or excretions. Wear the right gown for the right task. Avoid brushing up against surfaces in the patient care area or your work area. This would reduce the chance for transmission of pathogens and germs. Gowns that are not clearly marked with a designated AAMI level should be physically inspected and determined by the wearer if it offers enough protection for the task at hand. Fasten the gown completely for maximum coverage. Wash your hands with soap and water before and after removal of the gown, or use alcohol-based hand sanitizer. Dispose of the gown in the proper receptacle as directed by your facility. Some gowns are laundered, so make sure to check with your facility. This next simulation video is going to demonstrate a selection of a gown and key differences in features of the gowns. Now, if you'll notice, these videos don't have any narration with them, and we do this purposely because we want to be able to give you that opportunity to tailor the message to fit the needs of your department. The video will show an unrated gown, then level 1 through 4 gowns. Some questions you may consider. What did you think of this simulation? Did you notice the differences in the fluid resistance of the gowns? Do you feel that the simulation adequately demonstrates the differences in the levels of the gowns? How could wearing a gown that is inappropriate for the task attribute to germ transmission to another person or surface? All right, so again, we're going to choose the appropriate level gown for the appropriate task. First step in that is knowing what levels go with what types of tasks. We want to make sure that we're removing the gown when it gets soiled or before moving to the next patient or task. This will prevent self-contamination and contamination of the environment and others. Make sure that the gown fits properly because people come in all shapes and sizes. Scrubs are not considered PPE. You still need to wear the gown. It is also worth mentioning that gowns are not jackets and should be worn appropriately for PPE purposes and not for warmth. Wearing a single gown is adequate. When you double up your gown, such as wearing 2 gowns at once, it becomes more bulky and may even give you a false sense of security if you try to remove the top layer gown and then wear the bottom layer assuming it's still clean. Also, make sure to clean your hands with alcohol-based sanitizer or soap and water before putting on the gown and especially after removal and disposal of the dirty gown. For this next activity, please turn to Resource PPE 2.1 in your packet. On the screen, I have provided the different gown levels as designated by AAMI. Scenario 1. Resident in long-term care facility currently in isolation for a multi-drug resistant organism. They are continent of stool and urine. What level gown should we select? A level 1 or even an unrated gown should be appropriate for this scenario. The rationale: unrated and level 1 gowns are appropriate for contact with minimal amounts of body fluids. If the resident is in isolation and care involves contact with minimal amounts of fluids during personal hygiene, movement, or general care, then either a level 1 or unrated isolation gown is appropriate. Scenario 2. Patient in emergency department with multiple trauma and they're involved in resuscitation. For this scenario, a level 3 or level 4 gown would be appropriate. The rationale? In this circumstance, it can be reasonably anticipated that the healthcare worker may come into contact with body fluids in quantities that could soak a portion of the gown. Therefore, higher levels of protection are needed, so level 3 or level 4 gowns would be appropriate. Now we are going to talk about the importance of gloves. In the pandemic, especially early on, we saw gloves being used in the general public like never before. The problem with gloves in this setting is that many people lack the basic knowledge of the cons of wearing gloves to do everyday tasks versus using good hand hygiene at the appropriate times. When used correctly, gloves offer protection to both wearer and those that they come in contact with from germs and other pathogens. In the healthcare world, we use gloves in the care of patients. Like gowns, gloves offer twofold protection to the wearer and to those they come in contact with, who are protected from anything that could be on the hands of the caregiver. Gloves come in all shapes and sizes and textures. Sterile gloves for sterile procedures and just regular gloves in a box for patient care or anything non-sterile. Remember to clean your hands before going after the glove in the community box to risk the spread of germs to the clean gloves in the box and potentially other people. It's important to wear a size glove that fits you well to avoid tears. Removing jewelry is also good practice prior to putting on gloves. Gloves are a vital form of barrier protection from germs, especially if you have a break in your skin. In this simulation station, we will watch as a few healthcare workers remove their gloves in a way as to avoid contamination to their hands. Using a powder that glows in UV light, we will then show the likelihood of contamination of germs to the hands during the glove removal. This in turn demonstrates the importance of cleaning your hands before putting on gloves and after the removal of gloves. Again, no voices during this video to allow reflection and individualized narration to fit your needs. So, we saw a great depiction of why hand hygiene is a vital part of wearing gloves correctly. There is no perfect way to remove a glove without risking self-contamination. Gloves do not take the place of appropriate hand cleaning, and we can't see germs. So this is even more of a reason to make sure we are doing our part with keeping our actual hands clean and not solely relying on gloves. Some key takeaway points. We want to make sure we're cleaning our hands with soap and water for the full time, 20 seconds before putting on gloves every time. We want to wear our gloves correctly, covering all exposed surfaces of our hands, and remove our gloves correctly to avoid hand contamination. We don't want to wear those double layers of gloves for routine care. You lose feeling or dexterity in your hands when you double up that layer of gloves, which can lead to needle stick injuries. Nor do we want to attempt to sanitize gloves because that can break down the material that the gloves are made of. New patient, new gloves every time. And last but not least, I cannot stress enough, sanitize or clean your hands with soap and water after removal of gloves every time. Now we will discuss donning and doffing PPE. Donning and doffing PPE is another way of saying putting on and taking off PPE. While no method is perfect, the order of these steps is very important in terms of making sure you are protected against self-contamination as much as possible. By donning and doffing PPE appropriately, you are helping to reduce the risk of germ transmission to yourself and also to others around you, including your patients. The sequence for putting on personal protective equipment is shown on the screen. The type of PPE used will vary based on the level of precautions required, such as standard and contact, droplet, or airborne infection isolation precautions. The procedure for putting on and removing PPE should be tailored to the specific type of PPE. Number 1. Gown. Fully cover torso from neck to knees, arms to end of wrist, and wrap around the back. Fasten in back of neck and waist. Number 2. Mask or respirator. Secure ties or elastic bands at middle of head and neck. Fit flexible band to the nose bridge. Fit snug to face and below chin. Fit check respirators. Number 3, goggles or face shield. Place over the face and eyes and adjust to fit. And number 4, gloves. Extend to cover wrist of isolation gowns. And don't forget to clean your hands afterwards. Doffing PPE involves removal of contaminated PPE in an effort to avoid spread of any germs on the articles. Doffing is demonstrated 2 different ways by the CDC. The first option is depicted on your screen. Notice that we take off the gloves first, then sanitize hands. After removal of the gloves, you can move on to the eye protection removal. Use hand hygiene afterwards. Now it is time to remove the gown. Untie, with ungloved clean hands, the tie at the neck and the back, then roll forward and away from your body. Try not to touch the front of the gown during removal, then perform hand hygiene. Last but not least is removal of the mask or respiratory protection. Again, with clean hands, avoid touching the front of the mask. Dispose of properly, then clean your hands. This second example is also an accepted method to doff PPE. In this example, the gloves and gown are removed together in one motion, rolling forward and away from the body. Hand hygiene is then performed. We follow with removal of the eye protection, avoiding touching the front of the goggles or face shield, then performing hand hygiene. Then it's time to remove the mask or respiratory protection. Avoid touching the front, clean your hands, and you are good to go. Now, we will look at 2 scenarios involving selecting the correct piece of PPE, putting them on correctly in the correct order, then taking them off correctly and in the correct order, and finally performing hand hygiene at the correct times. Patient care scenario 1. The patient is in the hospital for pneumonia. The patient is coughing sporadically. They are continent and they are cooperative. List the pieces of PPE to be used for this scenario and rank them according to order you would put them on. In this case, we will start with gloves. Then we will apply our face shield, eye protection, and then respiratory protection. Now, we will rank those pieces of PPE in the order of their removal. First, we will remove the gloves. Second, we will remove our face shield and eye protection. And third, we will remove our respiratory protection. When will we use hand hygiene during this process? Before entering the room, before removal of PPE, and then after removal of gloves and removal of other PPE. Rationale. A patient cough may disperse respiratory particles into the face or eyes of the healthcare worker. Masks and face shields protect the face and eyes. Gloves may be worn depending upon the patient contact anticipated to occur during that encounter. Remove most contaminated items first, then proceed with removal in alphabetical order. Scenario 2. A patient is having a nasogastric tube inserted. They are uncooperative, spitting, and coughing. List the pieces of PPE to be used for this scenario and rank them according to order you would put them on. First, we will put on the gown, followed by gloves. Next, face shield or eye protection. And last, respiratory protection. Now, rank those pieces of PPE in order of their removal. First, we will remove our gown and then our gloves. Next, face shield, eye protection, and then last, respiratory protection. When will we use hand hygiene during this process? Before entering the room, before removal of PPE, after removal of gloves, and after removal of other PPE. The rationale: in this situation, body fluids may come into contact with face, eyes, and clothing of a healthcare worker, so maximal protection is appropriate. Remove your most contaminated items first. In closing, PPE is used in healthcare both to protect you and to protect others. Eye protection is recommended to prevent germs from being introduced to the eyes either directly, through blood splashes, respiratory droplets generated during coughing or suctioning, or from touching the eyes with contaminated fingers or other objects. Using gowns and gloves is an important strategy for infection control. Gowns and gloves protect you and keep you from accidentally spreading germs into your environment. Gowns and gloves must be worn properly to be effective. It is important to apply and remove PPE in the right order and to perform hand hygiene at the right time every time. And remember, PPE is just one tool we use to help with infection control. Thank you for this opportunity to discuss PPE. I encourage you to visit the Project First Line section of the CDC website for detailed information on this topic and other infection control modules.
Well, there we have it. And welcome, John, to the show. Yeah, I think I got you muted there, John.
Got it. That was the problem, actually. That's why it led to the delay, because I couldn't get the audio to work on StreamYard. So glad I could join.
Yeah. Sounds like it's working just fine. So yeah, it was interesting. I learned a few things myself on that talk about PPEs. So Lori, what do you guys typically use for your office? I mean, I don't know, in a urology office that we down all the stuff that they mentioned, but what are your thoughts?
No, but I think that it's important, especially, we don't think about this, and nor, since we've been in urology so long, and back in the day, we barely wore PPE. And now they've come to the point where even with cystoscopies, you should be wearing a gown. And cleaning the scopes are really important. We have to wear a gown. We have to wear, goggles that actually cover the entire side. They're basically goggles and gloves. So they've become a lot, more strict about this than back in the day.
Yeah. And it's done to protect the employee. I mean, it's not so much that we're trying to protect the patient, but we're protecting ourselves.
Right.
I'll tell you a quick story that kind of convinced me is back in the day, and this might be before you guys were even practicing, but when a catheter balloon wouldn't pop, or you couldn't take it out, we would pop it by squirting ether into it. And the ether would dissolve the latex, and then it would be easy to take out. And that was the standard routine. Well, I was helping to do this. And the thing is, you had to use a glass syringe because otherwise it would eat up the plastic syringe. We're trying to do this. I'm with the doc, and I used to wear contacts at the time. And all of a sudden it popped off the lure lock and sprayed into the room. It wasn't any patient contamination, but I ended up getting some ether in my eyes. Fortunately, ether, I was able to rinse it out and it numbed my eyes, so I didn't feel it. But at that point, I decided maybe glasses weren't a bad idea. Although I know it's not enough enough to prevent all contact, it does prevent some. John, any thoughts on your office and your own practice?
Yeah, this is something that you have to keep in mind. So when I examine patients, first of all, washing your hands, my hands are horrible because I use the alcohol stuff all the time before I even touch my tablet, or especially after examining a patient. So for me, I still do digital rectal examinations. Of course, put the gloves on, do the exam, and then take the gloves off. And the next thing I do is to wash my hands. And you think, oh, the gloves protect me. Why do I even need to wash my hands? Well, as we saw in the video, it doesn't really do it does a good job, but it's not perfect. So a lot of germs are contaminating our fingers and our hands all the time. And then we all touch stuff we don't even think about, like our eyewear and our faces or our noses. And that's why during the pandemic, so much emphasis was placed on personal hygiene, which is the biggest source of contamination and cross-contamination.
Yeah. That's a good point. I once had a patient call me on it because, of course, having a beard, I was doing one of these, She goes, you're touching your face. Like, I didn't even think, it was unconscious. I was just doing it.
And patients watch. They watch, especially nowadays after COVID. They're watching everything you do as far as, hand sanitizer and cleaning and touching what you're touching. And yeah, they're very aware.
Patients are watching everything.
Yeah, a lot of live audience out there. Katie Bertel, welcome. Fran Foley, Diane Clowers, Nisha McMeo, Charlene Vollmer. Any thoughts you guys have on what type of things you're using in your office or concerns? Throw those into the comments. We'll be glad to bring those up for you.
One thing
Go ahead, John.
Yeah, one thing that wasn't mentioned in the video is that I started thinking about fumes, not so much stuff that you touch or sprays of fluid, but fumes. And when I perform vasectomies, I use a bipolar cautery, and the fumes are constantly being emitted, although very briefly, but still I'm inhaling the fumes. My medical assistant is inhaling the fumes. So I purchased something to evacuate the fumes will turn on and just remove the fumes from the area. And instead of rising up to our faces, it would just get sucked elsewhere. Something to consider.
Yeah. There was a report of, when they fulgurate condylomas, they have all that condyloma being vaporized, as you just mentioned, and that somebody had developed nasal condyloma from burning enough warts, I guess. The virus travels in the fumes. So definitely a good point. You need to wear some kind of protection.
Yeah. Whenever we perform CO2 laser ablation of the condylomas, there's always a vacuum right there.
Yeah. So yeah, I think that it's easy, it's easy to ignore what you can't see. So sometimes you like you said, when you saw that demonstration of how much got through a pair of gloves with that UV light, you're like, I know I try to be pretty diligent about washing my hands in between, but you always kind of got the gloves on, so you figure, well, okay, I got gloves on, right? Should be good. Not so good.
Even in this studio. This is a studio. I don't see patients in here. But I may come in after seeing the patient, having to use the alcohol or wash my hand. But still, when I come in here, I'm touching keyboard, mice, the desk, sound mixer. I'm still touching something. So maybe a little paranoid. I don't know.
I don't know. I think it probably makes sense to be a little paranoid. Always err on the side of caution.
Do you guys feel like nowadays that it's so clean that's why people are getting sicker, because they're not building up immunity to stuff?
It's a good point. Yeah.
Well, I grew up in Taiwan back in the 1970s, and we had open air stands that, forget about any sort of sanitation standards. When people so these stands are what they have a butane tank and a burner, and it's really literally open air, and someone would just push this thing around. They would make the food, and what happens to the food that is unfinished? Well, they put it in a big old bin, and right next to where they're cooking, there's leftover food that is just open. So I think because I grew up in that environment, I think I built up a lot of immunity to the bug. So to your point, I think, yes, I think brief, small exposures over time may help build up your immunity and memory T cells to fight against future infections.
Yep.
Yeah. Fran had a comment that it's mandatory to have smoke evacuators while using any of these items.
And I think that Fran's probably referring from the OR side. I just wonder how many offices have smoke evacuators in their office, because I don't know that that's a standard. If anybody can chime in on that, I'd be interested.
Yeah.
Well, how many offices are actually doing procedures where fumes are being emitted from cautery?
Yeah.
Probably not many. I don't know.
Right. Yeah.
And even in some surgery centers and hospitals, not all of them have the suction, or the smoke evacuation built into the cautery pencil. So I don't think that is the standard at this time, even though it's recommended.
Yeah, yeah, definitely. And Fran did specify that was the OR
It
she
was
was
the
talking
OR.
about, that it's mandatory.
And
I think that
especially
makes
plastic
sense.
surgery where they're doing a lot of cautery.
Now, Lori, what about BCG in your office? Do you mix BCG in the office?
Yeah, we do mix BCG in the offices. It is a closed system, but we still are required to wear a gown, a mask, and actually we do use chemo, even though it's not a chemo, we do use chemo-approved gloves for that.
Yeah. And John, do you guys mix BCG in your office?
Yeah, closed system. So we use the typical recommended precautions.
Yeah. Used to be the BCG didn't come in a closed system, and
Nope.
it didn't have that built-in filter system and all that. And
I was pregnant doing it by hand with needles and drawing it up, and I'm still here, people.
that doesn't mean it was right, though.
No, it doesn't mean that it was right.
All right. Looks like we have another comment. Go ahead, Lori, read that off for me.
So during COVID time, no one could call for UTI because everyone washed their hands. Nobody, I'm not sure what he's trying to say.
Oh, I think there were no UTI reports coming into the office because everybody was washing their hands.
Oh, yeah.
Yeah. Good
I don't know if UTI and hand cleaning. Oh, unless maybe if you're self-catheterizing, that may play a role. But as far as voiding,
not a typical
yeah,
way to catch a UTI, but
yeah,
who knows?
Right. So Nisha said, or Nisha, I'm not sure how to pronounce your name. This was a great refresher. I have made it a habit recently to use sanitizer only twice in a row when seeing patients and then washing for the third time. Post-COVID patients appropriately expect to see us cleaning our hands. If patients don't see us cleaning our hands, then it's not done. And it's true.
Yeah, that is a good point.
Yeah.
One thing not related to the hand cleaning and the donning and doffing of the gowns is that the general office appearance, as you said, Lori, people are judging us from the moment they try to contact our practice through our website. And then as soon as they come into the physical plant, they're judging how clean or the type of service that they expect to receive, depending on the cleanliness and the organization of the office environment. So if you have chipping paint or defects on your wall and you don't clean underneath, for instance, the exam tables, you know how the head lifts up. There's that surface right underneath it. If it's all dusty and dirty, people are going to judge. Well,
yeah, and even if there's something out of our control, like a little fly that gets in, you're like, everybody's, yeah.
Yeah.
And I think you get used to your environment so that you don't notice this stuff. It's there all the time. So it's just kind of in the back of your mind. You don't really pick it up. But like you said, a patient comes in and says, "Is that blood on there?" And you're like, "Oh no, that's a rust stain." I'm sorry.
Or betadine that we splashed on the wall.
So it's important also the positioning of our patients. They're usually supine, and it would behoove us to look up in the ceilings once in a while because that's what they see.
Yeah.
So if you have water leak stains on your ceiling tiles or, God forbid, sprays of whatever it is that up in the ceiling, you want to make sure you get that cleaned up.
Yeah. That's good points. Right. Great.
So thanks, Nisha. Thanks for the clarification. Appreciate it. And then Charlene, we call the yellow gowns for basic use. Looking at situation of bodily fluid and isolation, we have the heavier blue gowns. Lab and surgery have special gowns. Infusion also have gowns that are used for their use. Smoke evacuation looked at in our cautery surgical areas. Dialysis, all use of goggles, special gloves, and gowns for heavy body use. Kidney transplant from 70s, we were strict isolation and decreased visitor, etc. Hand washing strict as well as gloves.
Oh, good points.
Yeah.
We use the ones that are like they're plastic and they've got a hole that your thumb goes into, so they cover your arm.
Oh, the gown?
The gowns, yeah.
Interesting.
I don't know. They didn't really show a plastic one. We weren't using the ones that look like cloth, but ours are actually plastic, and they, like I said, they cover you all the way. When you pull your gloves, you're pulling your gloves over the gown.
Yeah, I recall those plastic gowns. Yeah, with the hole right here for your thumb.
Yeah.
I remember those. They're hot though.
Otherwise, yeah, that's the only problem. It's good for short procedures. You don't want to be in those a long time.
Yeah. I've gotten so far as when I do a TURP, even though all the action is inside the body, as soon as I take the telescope and the working element outside of the patient, now I have a direct connection between the bladder and the outside. So all the fumes from the TURP actually comes out. Now I have a suction actually that is running all the time, and it's a tiny little tube. As soon as the device comes out, while the sheath is still in, the scrub tech will actually put the vacuum right next to the outlet to minimize the fumes that are coming out. Because often, apparently, some people have said that, yeah, I can always tell when Dr. Lin is doing a TURP because we can smell what is going on in the hallways. So now I suck the fumes as much as I can, so not everyone's exposed to the fumes.
Yeah.
Maybe a little overkill.
Maybe, but again, is it ever bad to overkill? As long as we're not the ones getting killed from the effects of not doing it.
Yeah.
Right.
So let's see. We got Amy Wayne came in here with thank you for refreshed information. Yeah, it's kind of why I just decided to do this one.
Yeah.
Is I just thought, sometimes we just take stuff for granted. We just it's so much what we
It's
do.
like, I know how to wash my hands.
Exactly.
And we're all in a hurry, and we all tend to cut corners, and that's one corner you don't want to cut.
Yeah. So I think it pays to have a good reminder every now and then to do things right. And hey, 3/4 of an hour worth of CE to fill out a quick thing at the end of the day or at the end of the time over on our website makes a lot of sense. Sometimes
appropriate hand washing. Let's not forget how to actually wash our hands, making sure you're getting the tips of the fingers, between the fingers, back of the hands, as well as we all do the front. So make sure those other areas are not missed.
Yep.
I'm a good old hand washer. I'd rather wash my hands than use hand sanitizer. I feel like I'm getting it off.
my wife hates hand sanitizer just for the reason. She says, you're walking around with dead germs on your hands.
Right. Right.
It's really not wrong. The sanitizer kills the germs, but it's not like water where it sheds it off as well. So good point.
And my next stop actually is to go to Costco because we're almost out of soap at home. That's so timely. This is so timely.
Yeah. See. Oh, it's great seeing everybody kind of getting the crew back together. It's always great to see you, John. And Lori, can't do the show without you. I'm going to put a little plug in for next week's show.
Next week, we are joined by Dr. Asdali, Medical Affairs Senior Director, Continence Care and Infusion, and Danny Williamson from Convatec Continence Care. They will deliver an insightful presentation showcasing Convatec's advancements in intermittent catheterization technologies. Their session will highlight independent evidence from Queen's University Belfast, focusing on the evolution of catheterization technology and the rigorous in vivo and ex vivo model testing of Convatec's next-generation Feel Clean technology. They will also compare the performance of Feel Clean against other leading PVP hydrophilic-coated catheters, providing valuable data on its superior efficacy and patient-centered design. Join us next week to learn more.
Yeah, the urinary self-cath has gone through so many changes and so much development. It's always nice to kind of hear what the latest and greatest is, especially if you're using them. So, hey, if you're with us today and you want to hang around at 10:30, there's UroPatient coming your way. We're going to be talking about how to get ready for a prostate biopsy. Watch this first because a lot of guys are super panicky about it, and I don't think you need to panic so much. And then be sure to join us on this coming Tuesday, February 18th with Dr. Jeff and Dr. Littner's joining him. We're going to be talking about keeping the flame alive in relationships. Get my name out of the way there. In relationships. So join us this Tuesday at 7 p.m. Central Time for our newest podcast on Dr. Jeff Talks About Sex and Intimacy. So with that, I'm bringing my crew here. Have a great day, everybody. Hope I know John's not suffering too much from snow in Arizona, but
nope, not at all.
So hot in the summer. I gotta go out now and shovel my stairs because I got another 3 inches over the past night. We've got about 6 or 8 inches of snow here.
That is something I don't miss.
Yeah, I know. All righty. Have a great day, everyone. See everybody later.